Hello, and welcome to this first episode of TaxiBiotech, a program to discuss news and updates from the world of biotechnology and the related investments. This is a first trial episode to see how well this format works, to practice with the platform, and a bunch of other things. I don't have an editor, so this video is recorded raw, without modifications. There will be few views, I don't mind. This is a hobby. I use this hobby to stay updated in biotech news, learn about biotech stocks and their behavior, and practice English, of course. The stock data I present here are a reflection of the company's progress or their clinical trials and do not constitute any investment advice. Let's go! The first piece of news that I want to share is about Greystone. They have released interim data from a phase 2 trial. And look, if there is a set of keywords to watch for in pre-release, encouraging is one of them. It means they haven't reached the statistical significance, but they see a trend or got close. This is misleading. If it is not below 0.05, the hypothesis isn't confirmed. There is no place for sugarcoating that. But be calm. They could be a way to rescue this data. They mention a subpopulation where it works better, and they would talk to the FDA about including it in a possible new trial or phase 2, taking into account this subpopulation. Where it is here. I will share with you every links in the box of comments, okay? Obviously, if the trial fails but they found a trend in a subpopulation, it's not a good thing. Moreover, when they don't have a very big pipeline, so if one molecule fails, the company will be punished in stock market. And we can see here the difference from the day before of the press release and the moment when the press release is shared with everybody. We can see a 70% decrease in the stock price, and this could happen with these tiny biotech companies with a capitalization of $22 million is very small, and we can see a large up and downs every day. This is the crypto of the Nasdaq, so be careful trying to trade in this. We can read another news, this about PDS Biotech. PDS Biotech presented 36-month data in cervical cancer patients treated with Versamune and its viral vector plus chemotherapy. There are key points in this press release. It seems safe, which is the most important aspect in this type of trials, due to problems that similar trials have faced in the past. That's my personal opinion. They comment few data, few percentage, and they share with everybody 74.9 progression-free survival in their trial. This is the most important data for me. They also report 100% overall survival when all doses are administered to the patients, but I find the almost 75% more representative, as being able to administer all doses over time might indicate that those patients were either responded well from the start or simply tolerated the disease longer. I have to say that this is a single-arm trial, and they minimally compare it with data from other studies, where they mention the median overall survival. However, this comparison is, for me, is not very relevant because they are different trials. So, as key important points, safety in this trial is very important, and there are promising data, but there is still a long way to go. So let's check their stock to get a sense of how expectations for the result are shaping up. Sometimes these graphs are very telling, and other times not so much. This first chart doesn't tell me much. There are no big fluctuations, and that it's I like that this is stable. In small biotech companies like this, a spike could occur, or with very promising news, or the stock could go down 80%, as we saw with Gristons, if Versamune fails in this case, um, because their pipeline is basically this component. So this is a tiny company, so every news or pre-release could affect dramatically to the price of the stock. So we can continue to Teva news. Teva also published another press release and got my attention. Teva announced the launch of a generic drug. I knew the company, I knew the name, and I decided to look at their pipeline. I was surprised by the sheer numbers of products that they have. It's a monster. I was looking for the products that they have, and I didn't know that it's is this kind of big. And I like mm, that that they have generic drugs that they renew almost each month, so it's good for the company. Then I saw the stock that it performs poorly in the past, but in the last months they have a very good trend. This happened because they had several scandals in the United States. I'm not going to enter into that, but I was looking to their 10Q every quarter reports, and we see that they are losing money here, mainly because of their goodwill impairment. The goodwill impairment occurs when the value of the company asset that they bought in the past, now the price is less than they paid. So I was looking to the reasons of their goodwill impairment is so high, $700 million in 1 year, and in in 3 months. So I don't know why this happened. Um, if anyone knows, please leave a comment. I'll keep an eye on it from time to time, but it's just for curiosity. Now let's talk about the worst performing stocks of the past week, and I want to understand the reasons behind their poor performance, just to learn about why this happened. One of them we already know, Princeton, okay, and we saw it. There is addicts. I don't know how to pronounce it very well, but they share with investors press release um, explaining that they are in the process of acquiring two other companies, but they need cash to finalize these deals. and pay off some of their debts, the company that they want to buy, the debts of the company that they want to buy. They have performed a reverse stock split 40-1 in the goal of remaining listed on Nasdaq, which requires a minimum share per price of $1. They might sell up to 250 millions in shares they if they can see that it's necessary. You can see here in the press release. If I made a mistake, please verify reading the press release yourself. The chart really reflects these negative expectations, so with a dramatically decrease. In Twitter, some people, or in X, some people, they're claiming for a short squeeze of this stock because of the because of, because the company is large in short positions. A gamma squeeze occurs when too much people is betting that this company is going to collapse, and they bet in the poor performance of the stock. If everyone here with this tiny market capitalization buy a significant amount of shares, the price will soar and a gamma squeeze could occur. This is just an hypothesis. I don't think that this is going to happen, but some people here, I don't know if this is a good analyst or is just a random guy with a false image, is telling this. So and we have another companies that are performing bad in the week. Shattuck Labs, and we can see here why. Sorry, this is Capricorn. Shattuck Labs, because they test their molecule in a trial, and they showed only modest improvement in overall survival. So these things happens, bad luck, and the stock falls 70% when the press release is shared to the public. This is normal because this company has a modest pipeline, so they have to reconfigure the company around these the other companies, the other molecules that they have. Now is soaring 20% today, because when you have a dramatic capitalization in the stock market, could come a very good candle in another day. And we are going to share with you the 3 better stock options in the week: Capricorn, Entero, and Q Biopharma. I was a little bit nervous because my daughter is around here doing some noises, and I thought that is going to enter in this room. We are going to comment Capricorn Therapeutics. They announced that they are going to file biologics license applications. This is the announcement of the announcement, okay? And when you have all the clinical considerations established, when you have all the clinical trials and the results are good enough to go for approval of a drug, then you have to file this form, BLA, biologic license application, and they are going to do that. Plan to commence to start in October 2024, and we can see here how the stocks this is September 24. This is September 24, and they soar 300%. We can see here that they were increasing their value days before, and this is because this is the reason because I like to look the stock market, because they usually go days in advance to the final movement. Sometimes not, but sometimes you could see these movements days before. Entero Therapeutics, another stock that grows a lot grew a lot last week, and they license and commercialize clinical trials management in virtual in remote. Okay, I don't think that this is huge, okay, but the price of the stock increased 60% in a day. What happened the other day? All the gains went to the floor, because it was not a really good or a really impressive communication. It's not a new drug. It's not something massive, and these things happens also in biotech stocks. One day is the heaven for the investors, and the other day is the same as the previous day. So these things happen in biotech stocks. We are analyzing market capitalizations so small, so these things are usual. One day you can see 60%, the other day decrease all the gains. So be careful trying to trade in that. And the last company that that we are going to talk about is Q Biopharma. Q Biopharma has some press releases. We can see here three of the last. September 26, they announced a proposed public offering, and in the same day they announced the pricing. Okay, the public offering for biotech companies is usually bearish. I mean, it's usually a bad thing, because they have to raise more money just to continue, because usually biotech companies are not taking money from the market, because they usually don't have a product in the market, so they have to do a public offering to take money and to continue doing research and going forward with the clinical trials and these things. When the company is not in a good economic situation, the public offering, it tanks the market usually, or at least I can see in the last months or years. But when the company has good with economic numbers, good clinical numbers, and they do a public offering, not asking for too much money, the investors could see that this is a good thing. This is a thing that is not too much money, that is just to continue, is just to continue with the normal operative, and to continue with good data. So usually this can happen, and we can see here that this happened. When they announced the public offering, they surged 60%, and days after they have another press release about scientific presentations in a congress, in a meeting, and they charge another 89% because of the good results. So this is bigger company than the others, and I think that they did the things well because investors um, put money in the stock market because they did the right things. So I would like to learn about these things, to try to understand the stock market with these companies, and to um, stay updated in biotech news, and obviously to improve my level of English, just to practice it. So leave any comment in the box of comments. Don't be so evil, and everything that you can share with the people to understand this market will be great for everyone. Bye bye, see you another episode.